Mr. Speaker, the crimes of Lucy Letby were some of the very worst the United Kingdom has witnessed. I know that nothing can come close to righting the wrongs of the past, but I hope that Lady Justice Thirlwell's inquiry will go at least some way towards giving the victims' families the answers they deserve. My department and I are committed to putting in place robust safeguards to protect patient safety and to make sure the lessons from this horrendous case are fully learned. I commend this statement to the House.
I now call the Shadow Secretary of State, Wes Streeting.
Thank you, Mr. Speaker. Can I strongly echo the sentiments of the Secretary of State and thank him for advance sight of his statement. I'd also like to welcome the appointment of Lady Justice Thirlwell to lead the inquiry in the case of the crimes committed by Lucy Letby, and I also strongly welcome his appointment today too of Baroness Lampard to lead the statutory review in Essex, and look forward to receiving further updates from him as soon as possible. Turning to the case of Lucy Letby, there are simply no words to describe the evil of the crimes that she committed. They are impossible to fathom. And though she has now been convicted and sentenced to a whole life order, the truth is there is no punishment that could possibly fit the severity of the crimes that she has committed. With Chester Police's investigation now having expanded to cover her entire clinical career, we may not yet know the extent of her crimes. What we do know is her victims should be starting a new term of school today. Our thoughts are with the families who have suffered the worst of traumas, whose pain and suffering we couldn't possibly imagine, who will never forget the children cruelly taken from them. We hope that the sentencing helped bring some closure, even though the cowardly killer dared not face them in court. I want to pay tribute to the heroes of this story, the doctors who fought to sound the alarm in the face of hard-headed, stubborn refusal. While this murderer should have been stopped months before she was finally suspended, were it not for the persistent courage of the staff who finally forced the hospital to call in Cheshire Police, more babies would have been put at risk. I'm sure the whole House will want to join me in recognising Dr. Stephen Brary and Dr. Ravi Jayaram, whose bravery has almost certainly saved lives. Blowing the whistle on wrongdoing is never easy, and that's why it should not be taken lightly. Indeed, you can judge the health of an institution by the way it treats its whistleblowers. The refusal to listen, to approach the unexplained deaths of infants with an open mind, to properly investigate when the evidence appears to be so clear, is simply unforgivable. The insult of ordering concerned medics to write letters of apology to this serial killer demonstrates the total lack of seriousness with which their allegations were treated. Can I welcome the fact that the Secretary of State has changed the terms of the inquiry and put it on a statutory footing? There must be no hiding place for those responsible for such serious shortcomings. It is welcome that the inquiry will have the full force of the law behind it as it seeks to paint the full picture of what went wrong at the Countess of Chester Hospital. And it is right that the wishes of the families affected have been listened to, and I welcome the fact that they're going to be involved in the drawing up of the terms of reference. I asked the Secretary of State, and in fact people right across government and people who hope to be in government in the future, to make sure that in future families and victims are consulted at the outset in awful cases like this and others like it. And can he assure the House that the families will continue to be involved in decisions as the inquiry undertakes its work? Mr. Speaker, no stone can be left unturned in the search for the lessons that must be learned, but it is already clear that there were deep issues with the culture and leadership of the Countess of Chester Hospital. And this is not the first time that whistleblowers working in the NHS have been ignored when listening to their warnings could have saved lives. Despite several reviews, there is no one who thinks the system of accountability, professional standards, and regulation of NHS managers and leaders is good enough. Why were senior leaders at the Countess of Chester Hospital still employed in senior positions in the NHS right up to the point that Lucy Letby was found guilty of murder. The absence of serious regulation means a revolving door of individuals with a record of poor performance or misconduct can continue to work in the health service. Does the Secretary of State agree that this is simply unacceptable in a public service which takes people's lives into its hands? The lack of consistent standards is also hampering efforts to improve the quality of management. I'm sure the Secretary of State will agree with me that good management is absolutely vital for staff well-being, clinical outcomes, efficient services, and most of all, patient safety. The case for change has been made before. Sir Robert Francis, who led the inquiry into the deaths at Mid-Staffs, argued in 2017 that NHS managers should be subject to professional regulation. In 2019, the CARC review commissioned by the Secretary of State called for a regulator to maintain a register of NHS executives with the power to disbar managers for serious misconduct. In 2022, the Messenger Review, commissioned by the Right Honourable Member for Bromsgrove, recommended a single set of core leadership and management standards for managers, with training and development provided to help them meet those standards. We must act to prevent further tragedies. So I welcome his announcement that his department is reconsidering CARC's Recommendation 5. Labour is calling for the disbarring of senior managers found guilty of serious misconduct, so I can guarantee him our support if he brings that proposal forward. He should also go further. Will the Secretary of State now begin the process of bringing in a regulatory system for NHS management alongside standards and quality training? Surely we owe it to the families and the staff who were let down by a leadership team at the Countess of Chester Hospital that was simply not fit for purpose. Finally, Mr. Speaker, I know I speak for the whole House when I say that the parents of Child A, Child C, Child D, Child E, Child G, Child I, Child O, and Child P are constantly in our thoughts, as are the many other families who worry whether their children have also been victims of Lucy Letby. We owe it to them to do what we can to prevent anything like this from ever happening again. And as the government seeks to do that, they will have our full support.
Well, firstly, Mr. Speaker, can I thank the honourable gentleman both for the content of his response and the manner in which he delivered it. And I think it underscores the unity of this House in our condemnation of these crimes and our focus on putting the families central to getting answers to the questions that arise from this case. I join him in paying tribute to those consultants who spoke up to trigger the police investigation and to prevent further harm to babies. And I note the further work that the police are doing in this case, and also pay tribute to the police team that I had the privilege of meeting, who again have worked incredibly hard in very difficult circumstances in the course of this investigation. As he said in his response, the families are absolutely central to the approach that we're taking, and that's why I felt it was very important to discuss with them the relative merits of different types of statutory inquiry. But their response was very clear in terms of their preference for a statutory inquiry, and I have certainly surfaced to Lord Justice Thirlwell some of the comments from the family in terms of the potential perhaps to phase that, but of course these will be issues for the judge to determine. In terms of his concerns around the revolving door, there are clearly a number of measures that have already been taken, but I share his desire to ensure that there is accountability for decisions, and indeed members of the House will know that in past roles I have been particularly vocal around making points in that regard, and I think again that is central to many of the questions that the families have in terms of the wider regulation within the NHS. He mentioned the importance of good management, and I'm extremely interested through this review and also the steps we can take ahead of the review as to how we put further support into managers within the NHS and also into non-exec directors. Indeed, the government accepted in full the 7 recommendations of the Messenger Review. The CARC review was largely accepted. There was the issue of Recommendation 5, and that is why it's right that we look again at that in the light of the further evidence. So it is clear a significant amount of work has already gone in. There are a number of figures, including Aidan Fowler, Henrietta Hughes, focused particularly on safeguarding patient safety, but we need to, in the wake of this case, look again at where we can go further. The inquiry will do that with the full weight of the law and the statutory inquiry, but I'm also keen we look at what further quicker measures can be taken, and indeed have been in regular contact with the NHS England to take that work forward.